Welcome to Providence Brain and Spine Institute's pre-op spine care class. My name's Kiani and I'm one of the nurses with the class, and we're going to be going over a quick overview of what's going to happen in the class. So there's going to be 30 minutes of the nursing section, there's going to be 15 minutes of physical therapy and 15 minutes of occupational therapy. Please know that this is just a generalized class. For those people that have not had surgery, this gives you a little overview of how to prepare and how to prepare after surgery, before and after surgery. Follow your instructions by the surgeon. That's the most important, but this class will also help you better understand what's going to be going on.
Hi, my name's Barb. I'm one of the nurses that helps teach the spine class. I wanted to touch base on some key points that you would want to talk to your surgeon about. When do you stop your aspirin? Are you on blood thinners? When should you stop that? Contact your cardiologist or your primary care to find out when to stop that drug. Are you on any autoimmune drugs for psoriasis or rheumatoid arthritis? You'll have to find out from that doctor when you can stop it and when you can restart that medication. Do you have problems with your bladder? Especially men, when they get older, they have problems starting their flow. And women, they have problems with leaking and bladder infections. The surgeon's going to want to know that. Have you had any problems with swallowing in the past or had chemotherapy or radiation? They're going to want to be aware of all this information prior to surgery. If you have any questions for the surgeon, write them down and have them ready to go for them to discuss.
Medications to stop before surgery. So 2 weeks before, we ask you to stop taking all herbal supplements and vitamins. Now people are looking at vitamins, and we ask that because a lot of vitamins these days have herbals in them. And a lot of the herbals these days have something to do with bleeding. 3 to 7 days before surgery, stop taking all non-steroidal anti-inflammatory medications. So that's your Celebrex, your ibuprofen, your naproxen, Advil, Aleve, and Motrin, okay? Again, this all has to do with bleeding. Now, day of surgery, take the allowed medications with a sip of water. And we mean a sip of water. I am sure one person's sip is another person's gulp, but let's do a sip of water, okay? So, let's look at the list. Are you ready for surgery? Sleeping, constipation, heartburn, nausea, bladder issues, bleeding problems, or blood clots, heart and lung issues, diabetes, depression or anxiety, infection after surgeries, any of these things on this list, we ask you to take a look at. So if you're not sleeping well, guess what? You're not going to heal well. These are important things to look at and make sure that you're in top form so that you're ready for surgery. Pre-surgical activities. Okay, so usually if you have not already gone to the pre-admit clinic, you want to go. That's usually in the St. Vincent Hospital, that's on the 8th floor, and then at Prof Portland, that is in the lab, okay? Usually hospital registration will call you. Of course, they want to go over all insurance information with you to make sure they're going to get paid. Medical clearance appointments, those you want to have done obviously before surgery. So if you're seeing a cardiologist, gastroenterologist, and what have you, you want to make sure that those are all cleared and you're able to have surgery, okay? So another important thing, and that sounds funny, is know who you will bring to the hospital and who's going to be taking you home, okay? That's an important thing because the hospital's not going to discharge you if you have no one to take you home, okay? Plan to have someone stay with you for the first couple of days once you are home because you just had surgery and you're going to be pretty weak and tired and medicated. And lastly, prepare your home, and occupational therapy will go over that with you. So, what to bring to the hospital? If you have a pacemaker, defibrillator card, bring those, okay? Glasses, hearing aids, dentures, any of those things you want to bring with the storage containers and your name on them. Important. You'd be surprised how many times these things get lost just in transferring patients. So that's important to do. Bring your pre-op booklet with you if you wrote questions in the back We did leave a space for that. If you were told to wear a brace, bring that as well. Loose fitting, easy to wear clothing to go home. For example, button-up shirts, zip-up shirts, that type of thing. Because remember, when you have surgery, you're not going to be moving the same way, okay? Shoes that you can easily slip into and that have a back, that's also important. I know flip-flops are great, but they're not safe, okay? Especially after having surgery. If you use or have a CPAP or BiPAP machine, bring that as well with your name on it. So now we're on the day before surgery. Usually, not always, anesthesiologists will call the night before. I said not always because they don't always know who they're going to have as far as the patient. You definitely want to limit your alcohol intake and no smoking 24 hours before surgery. Notify your surgeon if you're ill. If you're ill or if you're nauseous, this is something that you can let the anesthesiologist know because they can put some medication during the surgery for you. Okay, that'll help with that. You're going to pack your bag for the hospital. You're going to have your first HIBA-cleanse shower, and of course, nothing to eat or drink after midnight. If you go to the pre-op or pre-admit clinic, not always, usually you'll get something like this. It's called a HIBA-cleanse cleanser. It's just a small bottle. This is something, if you don't get it from them, you can pick it up at Walmart or any kind of over-the-counter store. Just a small bottle, okay? But what you're going to do, you're going to change the linen on your bed. You do not want to have any pets sleep in the bed. So if you have any pets, cats, dogs, I know we love them, but you can't have them in the bed. Remove all jewelry and piercings. You want to use a fresh, clean towel and washcloth with each shower. So you'll be taking a shower the night before and the morning of your surgery, okay? So in the shower, you can use your regular shampoo and soap to clean your face and your genitals. But you'll be using half of this bottle, half the bottle, to clean everywhere else, okay? So if you're having neck surgery, you want to really focus in this area. If you're having back surgery, focus in this area. Still go all the way down. The hard part is not that that doesn't lather as much, don't expect it to, is that you have to actually leave it on for 4 to 5 minutes. And they mean leave it on for 4 to 5 minutes. Okay, so set a timer, whatever you need to do to help you. Then you're going to rinse off, and then after you're out of the shower, nothing goes on your skin. That means no lotion, no oils, nothing. Okay? So think of this, everyone thinks like, oh my goodness, this is a lot to do. But think of this as your way of being sterile. Okay, this is your way of being sterile. So when you go into a hospital and you go to have surgery, that surgery room is a sterile, that's all sterile procedure. This is your way to be sterile, okay? So what to expect pre-op? So here's always the funny part. You want to arrive on time. Of course, you'll arrive on time and then your surgery is a couple hours later. But there's a reason. The reason is because at that time, you're going to have your nurse prep your skin. They're going to put IV. They're going to have you sign documents such as your consent. You'll actually meet, by that time, the surgeon and or anesthesiologist, usually both at that time. And that way they can go over any questions, okay? And if you have any questions, that's a good time to ask. So what to expect? So now we've made it past that pre-op. Now we're in the operating room, okay? You're going to be in the operating room for about 2 to 4 hours. Again, this is just a time period that we put there. Doesn't mean that that's the exact time. Your surgery, depending on the surgery and what they're doing, could be longer, for example, a fusion, or it could be shorter. Just depends, okay? You may have a tube, which is called a Foley catheter, that's going to drain your bladder. Hopefully you will have gone to the bathroom before, but not always. People are nervous, okay? You're having surgery. You will have a tube most of the time. It's called a JP or Hemovac drain in the incision site to drain fluid and blood, okay? Extra fluid and blood. So what to expect? Now we've made it in the surgery. We're done with that. We're in the recovery room now, okay? You're in the recovery room, but you're not going to get real rest. Why? Because nurses are going to be checking on your breathing, your blood pressure, heart rate, all of that all the time. Usually the first hour in the recovery room, every 15 minutes, you're going to have that blood pressure cuff go off. After that, it'll be every 30, then once an hour. But they want to make sure you're doing okay. And that's what I would want, right? They're going to give you medication for pain or nausea. If you're having any of those things, let them know. They can't read your mind, okay? Nurses will check if you have any new numbness or new weakness. That's also important. So I'm asking you to pay attention to your body. Pay attention to when you leave that surgery. I know you're going to be groggy and all these things are going on with you, but pay attention to what's new, if there's a new numbness. So if you had neck surgery and you're having new leg numbness, guess what? That's new. That's time to let someone know, okay? So normally you're going to be in recovery for about 1 to 2 hours, just depending on you and how you recover. All right. So now let's talk about post-op constipation and nausea. I know we threw this in there because it's an important topic. I know one wants to talk about it, but it's something that needs to be talked about. So stool softeners and laxatives, they help with bowel movements while on pain medication, because pain medication, guess what, does stop you up, okay? So you want to ask for these medications to help with that. Usually your surgeon has done this already. Before you even had surgery, they've already put in prescriptions for you to get stool softeners or laxatives, okay? Again, these are things that you can also get over the counter in case they haven't. You want to take your pills with yogurt, applesauce, or ice cream, something that's going to help coat your stomach. Again, this is all after surgery, so you're done with that part, okay? Eat small meals and drink fluids. You're going to be sitting up. Oh, believe you me, if you're in the hospital, physical therapy and occupational therapy will have you up and sitting, okay? And that's an important thing to do. Preventing pneumonia, okay, this is another important topic. Happens more often than not. So after surgery, patients have more shallow breathing, okay, because why? That anesthetic that they give you in that surgery when you're laying on that table, it not only stops your bowels, it stops and it slows down the breathing as well, okay? That closes up those sacs in the lungs. So this little device, this is called an incentive spirometer. Everyone that's either been in the hospital or is getting ready to go, you will have one of these, okay? This is going to help you breathe. It's going to help open those lung sacs up, okay? Important to do. Your nurse is going to pick on you. They're going to ask you to breathe in that, usually up to 10 times an hour. And we truly say, do it, okay? If this is going to help you, you've come this far, why not finish it up, right? Okay, and most importantly, you're going to get moving. Get moving. All right, now we're going to prevent blood clots. Again, if you're going to be staying the night over in the hospital, you're going to be going from room to room until you're able to get up with these little devices on your legs called SCDs, or sequential compression devices. What they do, they mimic you walking. It pumps air into those little devices that helps pump the blood up and down the leg, okay? Important to prevent clotting. They'll also ask you to pump your feet, just like you would on a plane, same thing. Okay, and again, there's that special thing that we like to say is get moving, another important thing. Post-op pain, okay, here's our famous pain scale that we all know, 0 to 10, 10 being the worst pain possible, right? So this is important, and I want everybody to understand. We expect you to have pain after surgery, and it may be different than before surgery. Now, why we threw that in there? Because you're going to hear from every surgeon, and I don't care who they are, they're going to tell you you're not going to have pain. Not true. Not true. I've recovered enough patients to know you will have pain. It may be different, but you will have pain, okay? The pain does improve after time, and that different pain that you may have and may be feeling is that incisional pain. So if you're getting surgery here, getting incision here on the back, that pain usually peaks around 2 to 3 days after, so you won't feel it right away because you're numbed up pretty well, okay? But expect pain. That's the number one thing. So what can I do to hurt less? Well, you can change your position. You can use pillows for support. So if you're usually a side sleeper, use pillows to help you. That can help, okay? Walking. You want to balance your activities throughout the day. Ice. And you'll understand why you don't see heat on here in just a few minutes, okay? You want to reduce stressors. So if, let's say, Aunt May is a stressor, Aunt May shouldn't be around for a bit, okay? Use music, meditation, deep breathing, anything like this that's going to help you relax, okay? That's only going to help you recover better. So now using pain medication, okay? So again, here we go. You can expect some pain, and you can expect it to increase because guess what? You're moving more. You're moving areas that you weren't moving before because you were in such pain before your surgery, right? And of course, tissues have to heal, all right? Your doctor does order pain medication and muscle relaxers after surgery. So you want to take your pain medication before your pain gets too high. Don't wait until it's an 8. Take it when you're about a 4 or 3, something where if you know you're getting ready to have physical therapy or you're getting ready to go walking and you need that medication to help you finish up that walk down that block, take it then, okay? Muscle relaxants. Sometimes, I know a lot of people have an issue with taking pain medication. Sometimes it's not the pain. Maybe it's just the muscle. You've worked it or overworked it. Take a relaxer. Take a muscle relaxant. If that helps, you don't need the pain medication. So that might have solved it, okay? So, at home. Okay, so some pain medications include Tylenol. Know your limit. The Tylenol limit is, I believe, 3,500 milligrams maximum in a 24-hour period. We say that because a lot of the medication that you go home with, Norcos, all those things will have some Tylenol in it. So you'll see 5-325. Well, the 325 is the Tylenol. So if you take 2 pills like that, well, you're already at 650. Do you see what I'm saying? Plus, if you take added Tylenol. So we just want you to think about that. Why? Because Tylenol is metabolized in the liver and you don't want to have liver issues. That's a whole nother ball game. So just remember, you may need to take that pain medication more regularly at first, then you'll slowly back off, okay? You never want to stop immediately because you're going to be in pain, and what good is that, right? Of course, no taking the NSAIDs, that's your Aleve, your ibuprofen during this time, and especially if you had a spinal fusion, okay? And of course, that funny part, which we threw in there, is no driving or operating machinery while on pain medication or muscle relaxants. No driving. That's a big thing, okay? All right. So recovery at home. Have someone put your pet in another room until you're able to sit down. A lot of times you'll have someone come home, the dog has not seen you in a few days. They're happy to see you, okay? But then sometimes you have that accident where they just jump on you and you fall over. Not good after you just had surgery. So have them put the pet aside, okay? For car rides longer than 20 to 30 minutes, you might want to consider stopping briefly and walk around. Walk around, that kind of helps relax the muscles and just kind of eases up that stiffness. You will feel tired for a few weeks. Just think about that. You just had a major surgery. Your body is trying to recover. It's okay to be tired. It's okay. All right? Use your neck or back brace if instructed by the surgeon. If they tell you to use it for this much time, use it for that much time, okay? Follow your activity restrictions. Of course, physical therapy will go over that with you. And of course, no smoking. So wound care, okay? You want to keep the wound clean and dry. You don't want to let the pet sleep with you. You want to remove dressings as instructed by the doctor. No soaking, so any hot tub, anything like that, nothing until your surgeon releases you to do so, okay? You can take a shower when instructed. You may need to cover the incision in the shower. The nurse will teach you how to do all that when you leave the hospital. This is an important thing that I want to add in is if you are leaving the hospital, if you're being wheeled out of the hospital and no one has gone over discharge or instructions on how to change your dressing, stop right there and make sure someone does, okay? That's an important thing because you're going to be on your own. You're not going to have the whole nursing team with you. You need to know how to do it, okay? So no rubbing your incision. You want to gently pat it dry after a shower. Change the dressing when it becomes wet. And of course, no ointments or lotions on the incision. So I love vitamin E oil as well, but don't put it on there, okay? So signs of infection. So now, when we talked about that long list earlier, previously, it had ice on there. It didn't have heat. Here's why. So each day you want to have someone check your wound daily. I don't know about you, but I don't have eyes in the back of my head. Okay, so you want to check. If you're by yourself, have a mirror. Pretend this is a mirror and look back and see what it's looking like. Okay, you want to call your surgeon if you notice any redness, warmth, or swelling developing around that wound. Any yellow, green, or white pus draining from the wound. Any excessive drainage. Foul odor, increasing pain at the wound site, any chills, fever of greater than 101, call the surgeon. So we didn't have heat on that on that other, because it mimics this. It mimics infection. That's what we want to pay attention to. And if there's any reason here, or if you have a question about it, it's better to call. So again, here we are back to when to call your surgeon. So signs of infection, which we just went over, any new weakness, any new numbness, okay? So again, we're paying attention to our bodies. We're paying attention to what's going on with it. What's new? Is something tingling that wasn't tingling before? Those type of things. You want to pay attention, okay? So if something new happens, you'll be able to know, okay, and let someone know. So any sudden increase in pain, not controlled by pain medication. Okay, swelling in the neck after surgery, important because you don't want the breathing part to close off. Any headache that is worse when you're sitting or standing and better when you're laying down flat. We put that in there because that is a sign of cerebral spinal fluid leakage, okay? So this is something, again, these are all reasons to call the surgeon. Any difficulty swallowing, rash, nausea or vomiting, swelling or pain in the calf, which we won't have because we will have been moving, right? Or we've had those devices on to help us with blood clotting. And then any bowel or bladder problems you want to call, okay? Which also we won't have because we're using our laxatives and our stool softeners. All right, so immediately call for any of these things. Please, don't wait, just call. There's always someone on call if you can't reach the surgeon that can help you as well, okay? Better safe than sorry. And that's it, folks. We're all done. Thank you.
Your discharge instructions should include information about how to change your dressing and how often the surgeon would like your dressing to be changed. Each surgeon has different dressing preferences, and it might look a little different than exactly what you see here. But typically when I'm changing a dressing, I copy what is already in place, and that usually is sufficient for the time being. Most dressings will be in place for about a week after your surgery, but the exact number of days should be included in your discharge instructions. Before I do any dressing change, I always make sure I've washed my hands. You don't need to wear gloves at home, but if you've washed your hands, that will help to prevent any infection to the surgical site. When you're changing a dressing, it's a great opportunity to assess the surgical site and see if there's any redness, any drainage, any funny smell, anything that looks different than it may have looked beforehand. If you do see any of those signs, you want to call the surgeon's office and let them know right away in case they need to look at any antibiotics. One of the most common dressings that you'll see is a Mepilex, and this is essentially just a large sticker bandage and is very easy to place. This one can last for up to 7 days once it's placed, so this one doesn't need to be changed as often. It is also plasticky on the front so that it is waterproof enough to shower over the top of this dressing. To place, it has a peel-off backing. And I peel off just one side to begin with so that I can align it to the incision area. It doesn't matter if you go top to bottom or bottom to top, but I align it to keep the incision central in the dressing. And simply stick on the half. And once that is well adhered, you can peel off the second half to attach the rest of the dressing. So with either a neck or a back surgery, you may see some different closures of the incision. One option is steri strips, which are essentially paper stitches. Now, if you see those on an incision, they will fall off on their own, usually within 1 to 2 weeks. So you don't have to worry about doing anything with the steri strips. You might also see skin glue, where the surgeon has just pinched the skin together and applied the skin glue. Or sometimes there are stitches or staples. The surgeon's instructions should include whether or not you need to come back in for follow-up to have something like staples removed. but the surgeon will specify if that's necessary. If there's just steri strips here, we'll leave those in place. And if we're replacing the dressing, oftentimes it's just a gauze and tape dressing. You may see this on a back incision as well, where it's just gauze and tape, and that's fine. So for this one, I use an appropriate size gauze. This one is a 4x4, which you can find at any local drugstore, as well as paper tape, which is also readily available. You want to cover the incision area and then apply the tape across it far enough so that it will keep all of the edges intact. Now the gauze and the paper tape will not stand up to showering the same as a plastic dressing. So any dressing that's gauze and tape, it's a good idea to have a shower cover. And these are either available to go home with from the hospital, or you can usually find them at any local drugstore as well. This one has adhesive around the edges, so I'm just peeling off the backing of the adhesive. And then that way the middle will not stick to the dressing itself, but it will stick around the edges. And I try to cover as much of the dressing as possible. And seal the adhesive edges around the incision area. Now, if the gauze and tape does get wet during a shower, that's okay, but afterwards you'll want to take off the saturated dressing and replace it with a clean and dry one. And that should last for at least another day or more. Regardless of the type of incision or the dressing, you do not want to sit in a bathtub, a hot tub, or go swimming to where you're submerging your incision at any time for at least 2 weeks, or until the surgeon has cleared you to be able to do any of those activities again. Regardless of the type of incision or the dressing, you do not want to swim, sit in a hot tub or a bathtub for at least 2 weeks until your surgeon has cleared you for any of those activities. No submerging your incision at any time. You also don't want to put any ointments, creams, lotions onto the incision. It will heal just fine without any additional ointments or creams. Only use what the surgeon or physician has prescribed.
My name's Kathleen. I'm a physical therapist. Physical therapy after spine surgery focuses on making sure that you can move correctly to get around in your house safely. And we also focus on making sure that you understand the correct way of moving. We have some precautions that we teach, and we call them spine precautions, and the acronym that we use is BLTs. And so you might hear people saying, avoid the BLTs after surgery. And I'll explain what that is. The B in the BLTs means no bending. Bending is when you're rounding forward at your spine. Bending occurs oftentimes. If you're sitting, we don't want you reaching down to the floor. If you're lying down, we don't want you sitting up from the bed like you're doing a sit-up. Or if you're standing, we don't want you to bend down like you're reaching for something low in a cabinet. Bending also occurs if you sit on a low surface. So if you sit on a surface that's very soft, like a soft sofa, and if you sink down, if you have to lean way forward to get up from that surface, it's a little bit too low. The rule of thumb is that you want to have the surface height above knee height and below hip height. For example, with this chair, it's right at knee height. And so to make it a little bit higher, I might want to put a folded blanket onto the chair so that the height of the surface comes a little bit above my knee. So when I sit down, I don't have to bend forward at my back. The next precaution is no lifting, and we recommend not lifting anything greater than 10 pounds. And so 10 pounds is about the weight of a gallon of milk. So at home we want you to avoid lifting things like a bag of books or a heavy bag of groceries. We want you to avoid reaching into the refrigerator to lift like a pot of soup. If you tend to use liquids in larger containers like milk, it's best to have those in smaller containers so that you don't have to lift a heavy weight. The T in the BLTs refers to no twisting, and so twisting is something that we commonly do. If you're sitting on the toilet, for example, if your toilet paper is a little bit behind you and you have to reach back for it, that's considered twisting, so you might want to move the toilet paper in front of you. If you're sitting in your recliner chair and if your light is a little bit behind you, if you have to turn to get the light on, it's a good idea to move that light forward as well. If you're lying in bed, if you were to reach across your body for the bedside table, we consider that twisting too. So twisting is anything when your shoulders come out of alignment with your hips. And so you want to avoid doing a lot of twisting after surgery. If you're standing, twisting happens often if you're moving from one surface to the other, so it's best to take a step and try to focus on keeping your back straight. And then finally, the S in the BLTs refers to limited sitting. And so after spine surgery, we want you to limit the amount of time that you're sitting in a straight back style chair. So a straight back style chair would refer to like a dining room chair or a computer chair where you don't have full back support. If you sit in a chair such as this, you want to make sure that you change positions after about 20 minutes. So we refer to limited sitting, meaning not sitting in one position for longer than about 20 minutes at a time. After you're sitting for about 20 minutes, just stand, stretch out your back, maybe take a few steps, change position, and then you can go back down to sitting. But the idea is that we don't want you like sitting in your computer chair for 2 hours in one position because that puts a lot of stress on your back. If you have a recliner chair where you have full back support, you don't have to necessarily limit your sitting to just 20 minutes. It's fine for you to sit up for a little bit longer in a recliner style chair because it provides full back support. So those are your spine precautions. Some other precautions that we talk about are to limit the type of exercise that you do after surgery. So in regards to exercise, we don't want you doing any exercises for your back that you might have been doing before surgery. We also don't want you to do any exercises on exercise equipment such as a treadmill or a stationary bike. The best form of exercise after spine surgery is walking, and we emphasize walking, and we'll talk a little bit more about how to pace your walking after surgery. We want you to avoid doing activities where you're doing any jarring motions or pushing or pulling. For example, some people use a grab bar to pull themselves up from the toilet. If you have something like that that you typically use to pull yourself up, try to avoid doing that after surgery. It's best to just push down onto the surface. Avoid any running or jumping, any motions that would be a jarring force to your spine. One technique in particular that we emphasize is the technique for getting up and down from a bed, and we call that technique the log roll. And the log roll emphasizes keeping your spine straight. So like a log doesn't bend or twist, we want to make sure that as you move from lying down to sitting up, that you're not doing any bending or twisting at your back. So I'm going to demonstrate that. I'll start from a lying down position. So lying in bed, you want to first make sure that the bed is flat. So if you have an adjustable style bed, flatten the bed all the way down. You're going to start by bending your knees to have your feet resting on the bed. Once you have your knees bent, you're going to move towards your side. Once you're on your side, you can start to bring your feet off the edge, and as your feet go down, your shoulders come up, and use your arms to push yourself up to a sitting position. So you can see that I wasn't doing a lot of twisting or bending at my back. To lie down, you're going to go in the reverse. So from this position, you're going to go down onto your side, and just rest onto your shoulders so that you can bring your feet up onto the bed. And once you're lying down on your side, you can rotate your body to lie onto your back and then position yourself comfortably. And I would encourage you to practice the log roll at home a few times so that you get the technique down. It really does make a difference in terms of the ease and comfort moving from lying down to sitting up. If your doctor does prescribe you to wear a brace after surgery, you'll be issued a brace either before you have your surgery or after you have your surgery. And the physical therapist or occupational therapist or nurse will teach you the correct way of putting that brace on. Oftentimes the physician will have you put the brace on and take the brace off while you're sitting up at the edge of the bed. If your doctor wants you to put the brace on in a different position, then the physical therapist or occupational therapist or nurse will give you that instructions. But I'm going to demonstrate putting the brace on while you're sitting at the edge of the bed. So once you do your log roll to sit at the edge of the bed, you can put your brace on. You want to make sure that you, of course, are not going to do a lot of twisting or bending as you go to put the brace on, so have the brace close by, or maybe have someone hand the brace to you. You also want to orient yourself to the correct way that the brace goes on. So most braces will have some sort of a Velcro closure in the front, and they'll have a solid back support. They'll also have two straps that are on either side, which help to tighten the brace once it's on you. But you want to start by making sure that those straps are loose. So I typically Velcro the straps towards the back so that they're out of the way. I'm going to fit the brace around my back, and I want to make sure that the brace is as low as I can get it. So ideally you want to have this front pad resting just right up against your thighs, and making sure that the brace is centered in the back. So I'm going to use the large Velcro strap to close the brace and make sure it's snug and fit as low as possible. Once I have that in place, then I can take the tightening straps and I'm going to pull out and then across to fit the brace. If I'm going to remove the brace, I'm going to first loosen the brace by removing those straps and securing them back towards the back part of the brace. And then I can undo the Velcro closure and take the brace off. Your physician will instruct you on when you need to wear the brace. Commonly, we have you wear the brace whenever you're up out of bed. So oftentimes you don't need to wear the brace when you're lying in bed. It's most common that you're wearing the brace once you sit up at the edge of the bed and then as you get up and move about during your daytime. The correct way for standing up and sitting down is important to learn so that you're not doing any bending forward from your spine. I'm going to demonstrate from the chair. If you're sitting in a chair, first you want to scoot towards the edge, making sure that your feet are flat. It's fine for you to use your hands on the armrest of the chair. And you want to pivot forward at your hips. So instead of bending at your spine, keep your back straight, pivot forward to your hips, and then you can use your arms to gently push yourself up and then reach back to sit back down.
So I'm Andrea. I'm from occupational therapy, and I'm going to talk to you today about occupational therapy's role with you after your spine surgery. We look at activities of daily living. So one thing we'll go over today is how to get dressed, especially your lower half. We'll also look at safety, getting up and down from your toilet, in and out of your shower or your tub shower. We'll work with you with whatever you have at home. And then we'll also go over how to get in and out of a car, all while maintaining your BLTs. And that's no bending, lifting, and twisting, not the sandwich. So before we get into that, what I'd like to do is have you go through your home and set it up for safety. So you may or may not be using a walking device after your surgery, and we just don't want you tripping over anything in your home. So take the time now to pick up any clutter from the floor, any loose throw rugs, roll them up and temporarily remove them. And then what I'd like you to do is go through different areas of your home that you use a lot, especially the kitchen, and do some rearranging, especially your pots and pans that you keep down low. You want to have it waist height so you don't bend. Also in your refrigerator, do some rearranging so you can access the things you need to easily without bending. Also, you may take a look at your bedroom, do some rearranging there. If you normally keep clothes in low drawers, rearrange it so it's waist height. Okay, so take the time to do that now before your surgery so your environment is set up for safety and success for you. Other things to talk about are pets. So if you have a animal or a dog or cat at home that you normally take care of, we suggest that you have someone help you with the care of your pet. Because most of the time we keep the food dishes and everything on the floor, and again, you do have that bending restriction, so it's just best to have someone else take care of them initially. Other things to talk about is we do encourage walking after your surgery, but please don't hold the leash of your pet, because even if your dog is a great dog, there is that tendency of twisting, and that's one of your other restrictions. So walk, but walk with someone who's holding the leash of your pet, not you, okay? Other things to consider is the doctors ask you not to sleep with your pet because they just don't want to find any kind of hair or anything in the bandage which could cause infection. And then lastly, they ask you to not let your pet lick your incision, again, just to avoid infection. So let's get into lower body dressing. So after your surgery, you do have a bending restriction, and oftentimes people say, well, what is that? Well, often I tell people you can reach to your knees. Anytime it's knees down, we consider that too much bending. So a couple of ways to dress your lower half is if you have good body mechanics, you know, your shoulders and hips aligned, and you're able to flex your leg up like this, you certainly can get dressed this way. So you can put your socks on this way, your pants on this way, without bending forward. Another way to do it is if you keep your shoulders and hips in alignment and you're able to maybe get your leg up on a bed or a surface, sitting surface like this. You can also reach to your sock and pants this way. So that's another way of doing it. But notice my hips and shoulders are mirroring each other, not twisting. And if those two methods are difficult to do, there's also long-handled equipment. And there's a whole array of equipment out there that can help you. One piece of equipment that I recommend to all spine patients, whether or not they have good flexibility, is getting one of these. So this is a reacher, and just because of gravity, everything tends to fall to the ground. So if you have a featherweight reacher like this, it's a nice handy thing to pick something up from the ground without waiting for someone to do it for you. It also can be a handy tool for getting dressed in the morning. So I'll give you a quick demonstration. You can use it to take off your shoes without bending or twisting, and take off your sock without bending forward. So you can see how handy that can be. It also can be handy for getting your pants on in the morning. So oftentimes I teach people, if you have a leg that's a little weaker, you want to put that weaker side in the pants first, okay? You're going to clip your reacher to the waistband of your pants, just drop them to the floor, and then you're going to lace it up over maybe your weaker leg first. Pull it up to your knees. Once it's to your knees, you can grab it with your hands, right? And then you can do the same thing for the other leg. Bring it back down, get your other leg in there, so you get the idea of how it can help you get your pants on. Another handy piece of equipment is this. This is a sock aid. This can be helpful for putting your socks on. How it works, often I tell people, is imagine this is your plastic foot. So this is the toe end, and this is the heel end where the strings are. And what you're going to do is you're going to take your sock and you're going to pull it over your plastic foot, just like you would your own foot. So you're going to pull it over this. You want to make sure the toe is snug at the top. Pull it down, and then make sure the top of the sock is straight all the way around to the bottom of the knots. Then you're going to just lower this down to the floor without bending forward. Get your toe in there, and with the gentle pull on the strings, voila, your sock is on, all without bending forward or twisting. Another helpful tool is a long shoehorn. So this can be helpful along with using the reacher to put your shoes on. There are things like elastic shoelaces, as you see up here in the slide. You don't necessarily have to go out and run out and buy those. You could just be like me and tie your shoes loosely so it's easy to slip on and off. And then if you pull the tongue of the shoe back, start with using the reacher. Clip the reacher at the tongue, bring it down to the floor, get your toes started, then take the reacher out, grab your shoehorn, line that up with the heel and slide your foot in. And voila, your shoes are on, all without bending, lifting, and twisting. The other thing your occupational therapist will go over with you is safety getting up and down from your toilet. So if your toilet is very low at home, people usually have the tendency to bend too much forward and push too hard with their arms. So I suggest you go home and practice getting up and down getting up and down from your toilet, and make sure that you're limiting your bending and limiting your pushing with your arms. You can use your hands lightly for balance, but again, we don't want you pushing more than 10 pounds through your arms. If you are having difficulty maintaining that good body mechanics with your low toilet at home, oftentimes I will suggest investing in a high toilet seat. So those are readily available out in the community. They even carry them at Fred Meyer's for about $20. And again, it'll give your toilet a little extra height, so it will make it easier to get up and down without bending forward. Okay, so we will practice this with you while you're here in the hospital, and we may make suggestions depending on what you need. Okay, other things that we will look at, and I know this is very personal, but is after having a bowel movement, many people tend to bend forward and twist to clean themselves. And again, those are two of your major restrictions. So what I'd like you to do now before your surgery is practice having good body mechanics and see if you can reach back there to clean yourself. If you can, great. If you find that you're struggling or that you're twisting too much, you may invest in something called a toilet tissue aid. You can even do something like this. These are barbecue tongs from the dollar store. These work great also. But what you're going to do is put the toilet paper in here, and you're going to wipe front to back. Then open it up, and the paper will fall into the toilet. And that way you don't twist for cleaning yourself after having a bowel movement. So again, go home and practice, and you'll have a good idea if this is something you will need. And again, these things are all available either online, you can get them from Amazon, or at medical supply stores. They would also carry something like that. The other thing your occupational therapist will go over is how to get in and out of either your tub shower set up at home or your walk-in shower. And there is a special way the spine surgeons like us to teach you. So if you have a tub shower combination, this is just to simulate the height of an average tub. So it's whether you have this setup or a walk-in shower setup, it's the same way. What they like you to do is face one of the walls of your shower or your tub, and you can lightly put your hands on the wall for balance if you need to, and then you're going to sidestep up and over that lip. Okay? And that way it eliminates a lot of twisting. And once you're in your shower, just be mindful that you take little steps so you don't twist while you're in there. Other helpful things that will be a good addition is making your own soap on a rope, and that is getting an old nylon, cutting it off at the waist, putting your bar soap in there, and tying the one end to your wrist. And then that way, if the soap falls to the ground, you can pull it up, because again, you do have that bending restriction. Other things that are helpful in the shower is getting a long back brush so that you can wash from your knees down, because again, you do have that bending restriction. Okay? And then to get out, again, face one of the walls, one leg up and over, then the other leg. And if you have a walk-in shower, it's the same idea. You're going to face one of the walls, sidestep over, same technique. Hello, I'm Andrea from Occupational Therapy, and I'm here to show you how to get in and out of your car after having your spine surgery while following your BLTs, so no bending, lifting, and twisting. So on your ride home from the hospital, we ask you to not sit in the back seat. There's not enough room for you back there, so we're going to have you sit in the passenger seat of the car. The first thing your helper is going to do is make sure that passenger seat is all the way back. So I put the seat all the way back so you have lots of room for your legs. The next thing you're going to do is look at the seat height. So if I come over and I see where that seat height is, it's above my knee, so it should be a good height for me to get in and out of. The next thing you're going to do is get a hold of a plastic bag, something like this. You're going to place it on top of the passenger seat. Now, if that seat height was too low, you could build up the seat height with folded up blankets or towels. Stay away from pillows. They're too squishy and people tend to slide off of pillows. So if you need to build the seat height, build it up with folded blankets or towels. So now at this point you have your plastic bag on the chair. You're going to back up, feel the car behind the back of your legs. You may reach back a little bit somewhere on the car for balance. Again, use your legs mainly. Try to keep good body mechanics as you sit on top of that plastic bag. Scoot back a little bit. And now at this point, you're going to make sure your hips and shoulders mirror each other. So you're going to go slow and make sure those hips and shoulders go together as you slide into the car. Then when you slide out, make sure your hips and shoulders go together. Scoot to the edge. And then make sure you do a nice stand, hips and shoulders mirroring each other. Thank you.